Hey Alan, how's it going?
Good, Hunter. Good to see you.
So I know that you have a lot of experience in the IHS field and IHS training. Could you tell me more about that?
Yeah, I started in Indian Health Service at in the early 1980s, kind of around the time Indian Health Service developed a public health approach to injury. And in the late 80s, mid 80s, the 86, the introduction to injury prevention course was started. And then the injury fellowship, which is a year-long training program, was started in 88. And right around there, also the level 2 course was started. All this oriented towards the idea that folks living in communities are experiencing injury, and there wasn't at that time any formal training program to teach a public health approach to injury. And there's always new people coming into the field in Indian Health Service. So the idea is to provide a foundation of training in the basic skill sets of a public health approach to injury. Those courses were at that time offered once a year. Eventually, it became folks realized, gee, if you have to offer it once a year and bring people to the course, that is really a narrow band that you can get folks into training. So eventually the courses were offered transportable. In the late 90s, Indian Health Service developed core competencies in injury, kind of similar to what Safe States did a couple of years later on core competencies, and eventually redeveloped the courses into what was called sequential and integrated. The idea is over 3 short courses, an individual could develop competencies across the core competencies of injury, and that's kind of where it evolved to, that you could work in a community, get your injury training courses more locally available, and apply them directly back in your community. This is all before web-based training was available. Yeah, I think it's really great that Safe States has kept the ball rolling on training, and Injury Prevention 360 now is something where folks can get online and take the training courses, not having to wait. I recognize, like, you're in the TipCap program, you probably got your hands full doing the work in the community, and
Yeah,
probably experiencing folks that are very passionate about the issue just because of personal experience and so forth.
yeah. Yeah, I met with a lot of people and I do stay pretty busy. We do everything ourselves with our community right now. We like through housing, most tip cap teams have like a contract through housing for them to do like the home modifications and everything, but we're so backed up in our tribe because there's 4 reservations on our tribe. So I'm doing that physically myself. So my hands have been pretty full. So Alan, with your experience with IHS and the IHS prevention, what evidence-based programs would you say worked for you or that you thought were the best?
Well, first
Fall
of all, I'd
prevention
say it's really
programs,
great
sorry.
using the term evidence-based, because back when I started in the field, there was always this dynamic that folks went through. Pretty common to say, I feel like this is the best thing to approach this problem with. And we didn't talk about evidence-based that much. It was more of a practice sort of thing. Well, what are you doing? What are you doing? And, evidence-based kind of came into the realm over time, where instead of doing stuff that you feel like makes sense, why don't we look at what science is telling us? And there's a lot of really good guides. Now there's a community guide for preventive health services that has injury prevention included in it, that through partnership between IHS and CDC, there's the tribal motor vehicle guide, which is just excellent to try to show communities, well, if you're going to work on motor vehicle injuries, in my time that was the big one that we worked on, because it was by far the leading cause of death for American Indians and Alaska Natives was roadway safety. There weren't a lot of seatbelt laws or practices out. Impaired driving was a big problem, and that tribal motor vehicle guide, I always felt like was a real watershed opportunity to provide tribes with guidance and information on what's worked with other tribes to implement motor vehicle strategies. I think of another one is the work that was done on smoke alarms with Sleep Safe was an early initiative in evidence space to try to get smoke alarm programs, smoke detectors into Indian homes. That was another one that comes to mind. Well, Hunter, it was really great talking with you today. It's exciting for me to see the work continuing in communities. Lots of fun stuff that you have in your future, and I wish you well. Thank you.
Thank you. It was really good to talk to you. Thank you for your time and give me a little background on your experience with IHS. That really helped. I appreciate it. Thank you.